Hello and welcome to Chapter 20, Allergic Reactions for the EMT. In this lecture, we're going to talk about allergic reactions and the self-administered epi. We're going to talk about some anaphylaxis and some various other things that go into allergic reactions. So, what is an allergic reaction? It is an immune system's natural response to a foreign substance in the body. An allergic reaction is that exaggerated response to that foreign substance. And an allergen is that substance that's causing that exaggerated effect. So what happens inside the body? Inside the body, at the first time, the first exposure, the immune system forms antibodies. Those antibodies identify and attempt to attack a particular foreign substance, and the antibodies combine with the allergen they were formed in response to. In the second exposure and subsequent exposures, the antibodies still exist, and the antibody combines with allergen, leading to the release of histamine and other chemicals into the bloodstream, and then these chemicals can cause harmful effects. So outside of the body, we see the typical signs of an allergic reaction. These things are caused by the histamine and those other chemicals. Okay, so there's inflammation and swelling, which is usually localized. It can become body-wide or systemic-wide, but it's usually localized. Bronchoconstriction, and then vasodilation. So bronchoconstriction is when our bronchi get constricted and they get smaller diameter, and then vasodilation is that where our vessels swell up to the size of Uganda. Okay. Anaphylaxis is a severe, life-threatening allergic reaction. It can cause rapid dilation of blood vessels, leading to hypotension and airway swelling. So it's not necessarily the trachea that swells shut, it's the tissues around the trachea that swell. And then bronchoconstriction, which leads to respiratory failure. Common allergens: insects, foods, plants, medications, dust, makeup, soap, anything that really anybody touches, eats, can become an allergen. Alright, so these are the most common ones that I think are out there. So bees, plants, medications, shellfish, and peanuts. So latex allergy is a common concern in EMS. Many patients have a latex sensitivity, and providers can develop a latex allergy from prolonged exposure. It's not really a big concern in EMS anymore, because we have latex-free stuff. So for us, you still need to know it, because there are some things on the truck that do have latex. So there's no way to predict the exact course of an allergic reaction. Severe reactions often take place immediately, but can be delayed 30 minutes or more. Mild reactions can rapidly progress to anaphylaxis. A little bit of my own story involving allergic reaction and anaphylaxis. I had to go into the hospital for some testing. They were giving me some x-rays, and they gave me some IVP dye. The radiology tech, the nurse came in, started the IV, started the medicine. It was all great and dandy. The radiology tech went out to go get the x-rays, take the pictures. She came back in. She asked me how I was doing. I was like, not feeling real great. Just kind of weird. So she was like, all right, well, if anything changes, let me know. So she goes out. She takes some more pictures. She comes back in, and she gives me. She asked me how I was doing again, and this time I was a little bit more. I was a little bit more weird feeling. So I had. It wasn't necessarily that my airway was closing up or anything like that. It was just some difficulty breathing. I had some hives on my stomach, and I was really, 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 really cold. So pretty much the next thing I remember is her saying, "Oh crap." She left the room. She went and got nurses, doctors, everybody. I remember them giving me Benadryl, and I do not know if they gave me any epi or not, but I know that they gave me Benadryl IV. And then the next thing I know, I'm waking up in the ER. So yeah, we went over to the ER, and once I got over there, I was getting a little bit better, starting to wake up, and the radiology tech came over, and she goes, in 30 years I'd never had seen an anaphylactic reaction like that to the IVP dye. Couple of the main ingredients, and they ask you like multiple times whether or not you're allergic to strawberries or shellfish, and they pretty much just ask you those. I mean, ask you over and over, and I'm not, and I still am not. So she said it was just a weird deal. So anyway, my own experience. It's the only one I've ever had. I get a little bit of allergies when I touch a dog or a cat. I get some hives on my arms, but that's about it. So skin signs and symptoms of an allergic reaction. So skin itching, hives. Hives are the big welts that can sometimes come up, especially like when you touch, like in my case, if I touch a dog, then I get hives on my arms, my forearms and hands. Flushing red skin, swelling of the face, warm tingling feeling in the face, mouth, chest, feet, or hands. And this is kind of what I was feeling the first time that tech came in and asked me how I was doing. She said, asked me how I was doing, and I really couldn't explain it. It was like this warm, tingling feeling. Okay, so it may include some facial swelling. Okay, he's got a little bit. You can see it definitely around his eyes, and then down here around his neck. These are hives. Okay, they're just kind of welts that form. In the respiratory system, you've got tightness in the throat or chest, cough, rapid labored and or noisy breathing, so stridor or wheezing, hoarseness, muffled voice, loss of voice. If you have stridor, you're going to, you can assume that it's probably an upper airway obstruction, so that trachea is now closing off, and because of all the tissue swelling around it. In the cardiac system, you're going to have an increased heart rate, decreased blood pressure. Remember, our vessels are swollen, are dilated to the size of Uganda. So when you've got these big, huge vessels and little bitty fluid going through, you're not going to be able to that the heart's not pumping enough fluid to get through. So it says, hey, I'm going to increase the heart rate to try and get more fluid to go through these big, huge vessels. And the blood pressure, because remember what the blood pressure does, it measures measures how much force is against the vessels. Okay, so yeah, so when that force is you can't force that blood, the vessels can't don't have enough force against them from the fluid, then our blood pressure is going to drop. Okay, generalized findings: itchy, watery eyes, headache, runny nose, a sense of impending doom. I also had this when I had my anaphylactic reaction. It was not a good feeling. So signs and symptoms of shock: altered mental status, flushed, dry skin or pale, cool, clammy skin, nausea, vomiting, changes in vital signs, increased pulse, respirations, and decreased blood pressure. So let's talk about how we can tell from an anaphylactic reaction to a mild allergic reaction. So any of the previous signs and symptoms can be associated with an anaphylactic or an allergic reaction. Anaphylaxis is when the patient goes into either respiratory distress or signs and symptoms of shock. So in our primary assessment, we're going to identify and treat life-threatening problems, ABCs, okay? In our secondary assessment, we're going to do a history of allergies, exposure, what was the patient exposed to, how was the patient exposed, was there anything new that the patient tried, like food, soaps, clothing, anything like that. Signs and symptoms, progression, and any interventions. Okay. We're going to assess baseline vitals and obtain the remainder of that past medical history. So for patient care, we're going to manage the patient's airway and breathing, apply high concentration of oxygen if the patient is in distress or appears to be having an anaphylactic reaction. Mild allergic reactions don't require oxygen necessarily, and if not breathing, provide adequate ventilations. So consider assisting the patient with an epi auto-injector, and if the patient is not wheezing or showing signs of respiratory distress or shock, continue with assessment and consult medical direction regarding the use of an auto-injector. So on this slide, I will say that you need to be aggressive with these patients, and you need to be able to have that epi auto-injector and give it early as soon as they start showing signs of respiratory distress or shock. Okay, we're finding out that not giving that epi auto-injector soon enough is actually harming our patients. So you've got to be able to recognize the signs of respiratory distress or shock and give it early. Okay. So when the use of an auto-injector may be appropriate is that if the patient has come in contact with a substance that has caused allergic reaction in the past, or if the patient has respiratory distress or exhibits signs and symptoms of shock. So like if somebody knows that they're allergic to bees, they carry around an auto-injector, then they're going to go ahead and give themselves that epi to try and avoid anything going on. Okay. After using the auto-injector, record administration of the auto-injector and transport the patient, reassess after 2 minutes. So we're going to, for after administering the auto-injector, we're also going to do some reassessment, and we're going to monitor their ABCs and vital signs, often reassessing and doing all that. Should you administer an auto-injector for a simple allergic reaction? Not maybe for a simple allergic reaction, but we should be thinking about the fact that this could progress to a severe anaphylactic reaction, and we need to do that. Okay, so what assessment findings would indicate the need for epinephrine? Again, signs and symptoms of shock, respiratory distress, or the patient has had an allergy before. So the EpiPen, okay, this is commonly prescribed to a patient with a history of allergy. Auto-injectors are common for people to carry or have at home. It's a hormone produced by the body, and it constricts the blood vessels and dilates the bronchioles. Okay, so that slide, if medical direction allows you to do it, then you can. In Missouri, it's in the scope of practice for an EMT to do. So side effects: increased heart rate and increased cardiac workload. Administering the auto-injector, it's a spring-loaded needle and syringe with a single dose of epinephrine. Upon administration, medication automatically releases and injects. Oops, that was an EpiPen. So we're going to obtain the patient's prescribed auto-injector and ensure that the prescription is written for the patient, the medication is not discolored, medication was not expired, and we're going to obtain an order for medical direction if needed. Remove the safety cap. Press the tip of the auto-injector firmly against the thigh, outside of the thigh, midway between the knee and the waist. And hold the injector in place until medication is injected, about 3 seconds. Record your administration time and carefully dispose of the single dose injector in a biohazard container. Save 2-dose injectors. Okay. So additional doses of epi reassessment may show that the patient's condition is deteriorating, and additional doses of epi may be necessary. It requires online medical control, requires bringing the patient's additional auto-injectors into the ambulance. So if no auto-injector is available, we're going to request ALS Intercept, treat for shock. Okay, so there's 2 sizes of auto-injector. There's the adult dose at 0.3 milligrams and then the child dose at 0.15 milligrams. Okay. So let's do some chapter review. Allergic reactions are common. Anaphylaxis is a true life-threatening allergic reaction, which is rare. The most common symptom in these cases is itching. Patients with anaphylaxis will also display life-threatening difficulty breathing and/or signs and symptoms of shock. Patients with anaphylaxis will be extremely anxious. Their bodies are in trouble and are letting them know. Okay. Signs and symptoms of anaphylaxis result in physiological changes, including that vasodilation, bronchoconstriction, the leaky capillaries, and the thick mucus. Excuse me. By quickly recognizing the condition, consulting medical direction, and administering the appropriate treatment, you can literally make the difference between life and death for these patients. So if an allergic reaction, in an allergic reaction, the body's immune system overreacts to an allergen and causes potentially harmful side effects. Anaphylaxis is that severe systemic body-wide form of allergic reaction and is a life-threatening emergency. EMTs must use assessment to differentiate between a localized allergic reaction from a systemic anaphylactic reaction. Remember, be always on guard to the fact that it could progress into anaphylaxis pretty quickly. Epinephrine is useful in anaphylaxis because it constricts the dilated blood vessels and opens the bronchial passages. Epinephrine has potentially dangerous side effects and should be only used in the event of anaphylaxis. Again, early on in anaphylaxis, very, very early. A 24-year-old male ate a meal that he believes contained shellfish. He is allergic to shrimp. He is sweating and nervous. He appears to be breathing adequately. You do not note any wheezing or stridor. His face is slightly red. His pulse is 88, strong and irregular. Respirations are 24. Blood pressure is 108/74, and skin is warm and moist. Should you administer epinephrine? This is going to be one of those things where yes and no. Okay, initially I'm going to say no. I'm going to hold off just to see how he does, and then maybe give him, in my case, maybe give him some Benadryl first and see if that works. But I'm always going to be on the lookout for any kind of progression into anaphylaxis. If he has an EpiPen, obviously that's something that you can do, and you can give it. But always be on the lookout for that progression to anaphylaxis if you have one of these calls. These patients, again, need that early administration of that epi. All right, so if you guys have any questions, comments, anything like that, let me know. Call me, email me, text me, and I'll answer those. And I will see you in the next lecture.